Your eye doctor may be the first to shed light on a serious health problem.
It might surprise people how often it's the eye doctor who picks up that the patient has diabetes. That is not at all uncommon.
People with diabetes need to keep close tabs on their blood sugar, cholesterol, and blood pressure to avoid major medical complications, including loss of vision.
Those three things make a huge difference, and every little bit that you keep them in more normal range or closer to normal range makes a big difference in whether or not you develop diabetic retinopathy and how quickly you develop and how serious it is once you get it.
Diabetic retinopathy is the leading cause of blindness among working-age adults. Some might have blurry vision or see specks in their field of view, but there are often no symptoms until significant damage has taken place.
It's starting to impact on a lot of the blood vessels, not just in the center part of the retina, but also in the periphery.
In diabetic retinopathy, normal blood vessels can swell, close off, or begin to leak. This can produce abnormal blood vessels and a thickened retina, which can destroy vision. Compare this retina with diabetic retinopathy to this healthy retina.
When the light comes in, instead of focusing on a nice crisp retina, it has to go through layers of fluid and thickened, swollen tissue before it focuses on the photoreceptors.
Fragile blood vessels can also hemorrhage, leading to a buildup of scar tissue and possible retinal detachment.
And that's a very significant cause of severe visual loss.
If diet, exercise, and anti-diabetes meds aren't enough to keep elevated blood sugar from causing retinal damage, then eye doctors can use one of two treatment options before moving to more invasive procedures.
One is with injections into the eye of drugs that help with leakage and help with growth of new blood vessels, and the second is with laser. And just rest your chin all the way down for me.
A pinpointed laser basically spot welds portions of a patient's retina.
And that works in one of two ways. One way is to actually cauterize leaky microaneurysms, and another is to thin the retina so that the available oxygen and blood supply does as much good as it possibly can and gets to the viable tissue as well as it can. We know over the next 5 years or so that laser is going to give you a better chance of holding on to the vision you've got.
People with diabetes should see their eye doctor at least once a year because a comprehensive eye exam is really the best way to determine if you're at risk for vision loss.